At Distalmotion, our vision is to enable greater access to minimally invasive surgery by empowering robotic surgery. We do this by removing the traditional barriers, complexities of robotic surgery, which makes it more accessible to more hospitals, to more patients, and to more surgeons worldwide.
Simplicity has been at the core of the design DNA of DEXTER from the very start. Robotics in itself is rather complex, but it was a conscious choice to hide that complexity below the hood of DEXTER, because we knew that when we made DEXTER simple, we could address one of the key adoption barriers that robotic surgery has still today, which is the fact that it is complex to learn for the surgeons, but also for the surgical teams, and hence complex to operate, and hence challenging to adopt in day-to-day procedures. It's a big engineering challenge, and hence kudos to the teams here in Lausanne to hide all the technical complexity, the performance, but also the safety behind the robotic platform, and to make it transparent to the user, because the surgeons, they should not worry about that. They should worry about the patient, and the robotic platform should be a natural solution that feeds into their existing patterns of performing surgery, of operating tools in the OR, because the more you can reduce those barriers and those steps, the easier and the safer it gets for physicians to adopt DEXTER as their robotic platform.
My most surprising impression when I get people to use the system first is this little haha moments they have when they say, whoa, I feel like I've done that for a long time. You know, they use it, sometimes it's just a day, sometimes it's an afternoon, a couple of days, but then they start thinking, well, that's very natural. I'm not changing a lot to my practice. I'm just like sitting at that console, but actually the operation I know, the maneuvers I feel like I know too, and the learning path, the wall to learn is actually very, very low. So that's, I think, the most surprising thing is that this robot is extremely complex to provide, you know, this excellence in surgical robotics, but at the end, it's been designed to make the journey feel extremely easy and safe for users. And this is always amazing me because it happens every time.
We want the surgeon at the center of how we leverage DEXTER, and we do this by making sure there's minimal changes to their existing work environments. DEXTER is seamlessly integrated into the OR. It's using existing workflows, meaning any imagery equipment you already have on site. You're using the same laparoscopic instruments that you're used for. You're using the same port placements that you're familiar with, which means that the surgeon is really just focusing on how they manipulate DEXTER for the surgery and not worried about any additional changes that might be happening within the operating room.
And I think this is where we started to understand the robot is here for the surgeon. The surgeon is not here to learn about the robot. And when you see this at case number 2 and 3 and people are starting to kind of naturally say it, express it, you know you are sitting on something very interesting.
This goes beyond just the surgeon for the full surgical team. When you're rolling in DEXTER, when you're draping, when you're docking, when you're manipulating and setting up the arms, it's very simple to use. When we think about accessibility, we think about different hospital sizes, different hospital sites of care.
What the team has done here is created, as you can see, a very small format, low profile, fully robotic solution. So you still get all the benefits of what a robot provides with wristed instruments, but you don't necessarily have to deal with the physical burden of a large robot.
This means that we're increasing the accessibility to different types of hospitals, hospital departments that may not have had access today to a robotic platform. It's mobile, that means you can move it from one operating room to another, so different surgical teams can share and leverage DEXTER within the same hospital.
We're really trying to, on a procedural perspective, empower robotics across all disciplines. So I think there's been great limiters, you know, in certain procedures. It just doesn't, it's not justified to allow a robot into the case, whether that's clinically or financially. It's just too big of a burden. We're really trying to make customers, hospitals, physicians, providers have the ability to not only use robotics in the high acuity cases, but also the ability to get the benefit of robotics in the lower acuity or high volume cases, which we believe DEXTER does.
With DEXTER, you're operating within a sterile surgical console, which allows you to be able to switch at any point during the procedure to operate robotically or laparoscopically when needed. This gives surgeons choice. They're able to choose what point in the procedure they believe they can do better laparoscopically or robotically, and you're able to switch from the console to the patient side within a matter of seconds. This enables them to choose what's best for the patient, really here focusing on surgeon preference to give best patient care.
Ultimately, it's about providing patients with the best possible treatment. And the best possible treatment means physicians need to get access to the best tools in each category. And you cannot be excellent in everything. We knew that we were going to be excellent in robotics, in simplifying the complex parts of minimally invasive surgery, suturing and dissection, and in providing surgeons with great surgeon ergonomics. But we knew that we could not be excellent in robotics and provide leading imaging and provide leading energy and provide leading generators, because you cannot win it in every single vertical. And so our choice from the beginning was to focus on the robotic vertical, but within that robotic vertical, we are now at the forefront when it comes to precision, dexterity, ergonomics, ease of use. Yet at the same time, we give surgeons the ability to use their preferred imaging, their preferred staplers, because we give surgeons the ability to access the patients at all time and use DEXTER as part of an open platform, as part of a collaborator at the table versus a barrier that separates the surgeon from the patient.